Merhaba, dear colleagues. My name is Mehmet Serhat from Istanbul, Turkey. I am an associate professor in University of Health Science and I am working oculoplastic surgery. Our interesting case is oculoplastic surgery. We have no financial disclosures. 48 years old man complaining of bilateral epiphoria and swollen and droopy eyelids and visual acuity, IOP, anterior segment and fundus examination was normal. Initial examination with, in the inspection, bilateral eyelid ptosis, and in the palpation, we firm masses in the temporal region of both upper eyelids was palpated. What is the second examination? The patient complaining of epiphoria, we checked lacrimal irrigation and bilateral nasolacrimal duct obstruction was observed at the level of lacrimal sac. The next step, radiologic imaging, CT versus MRI. Which one? We choose the fat suppressed contrast enhanced MRI, and we observe hypertrophy of the bilateral lacrimal glands. Next step, incisional biopsy of the lacrimal gland revealed non-recrudescing granulomatous inflammation. What is the diagnosis? The patients have additional systemic symptoms: fatigue, night sweats, cough, shortness of breath. The first initial diagnosis, tuberculosis, but PPD and other tests is negatively. What is diagnosis? The diagnosis is systemic sarcoidosis and initiated and immunosuppressive therapy, corticosteroids, methotrexate, and TNF-alpha antibodies. And the patients have epiphoria, and despite the immunosuppressive therapy, epiphoria not resolved. What is the next step? We performed bilateral external ductiocystoinostomy surgery in separate sessions, and biopsy of the lacrimal sac confirmed the diagnosis of sarcoidosis. A treatment of big orbital masses, the patients in follow-up is 4 years later and checked the MRI repeatedly, and initial exam and last examination, lacrimal gland dimensions and volumes is increased. And we confirmed the AST is radiologic imaging. This is the initial examination. We see the lacrimal glands, and the 4 years later, orbital MRI, lacrimal gland dimensions and volumes is very, very increased, and we see the axial section image. The other important issue is excision of the lacrimal gland mass is triggered dry eye. This issue is controversial. Some studies say to trigger the dry eye, and some studies the challenging debate. This is tear secretion is complex process, and this is the debate. And the patients confirmed the surgery, and we firstly operated left eye and excisional biopsy and confirmed the sarcoidosis repeatedly, totally excision. 1 week after surgery and 2 months after surgery, the patients on the left eye, and the patients wants to the other eye surgery, and we operated right eye orbitotomy. Firstly, marked eyelid crease incision, skin incision, orbicularis incision, and septum incision, and we observed the big masses of the lacrimal glands. We used the periost elevator, cotton applicator, Westcott scissors, Steven scissors, and traction of the silk sutures. We dissection, we should gentle dissection, because this difficult case prone to orbital hemorrhage and the injury to other eye tissues. Very big mass, and we should patience in this difficult patients, because this case prone to hemorrhage and other visual loss complications. And this mass, compared to orbital lymphoma, is what's the problem? Ah.
It's okay, just proceed.
Yeah, give him just 30
Can
seconds
I
more.
slide, please?
Okay.
This is the post-op. After bilateral orbitotomy, then we performed bilateral ptosis surgery, mullar mass conjunctival resection. This is the first photography and last photography in these patients. In summary, careful physical examination is crucial to making correct diagnosis in orbital cases. To our knowledge, this is the first case in literature in which initial signs of systemic sarcoidosis are bilateral nasolacrimal duct obstruction and lacrimal gland enlargement with intraocular findings. I would like to invite Istanbul for Viso Press Congress. Thank you.
Thank you, Dr. Mehmet.